Okay, today we're going to be inserting a nasogastric tube. We have checked the physician's orders, verified our patient with his name and date of birth against his armband, washed our hands, donned clean gloves. We're going to be sure that we have the patient in high Fowler's position. First, you want to check the nose for patency. So you're going to occlude one nair at a time and ask the patient to breathe in and breathe in, okay? Both of the nostrils are patent, so we can go into either nostril. You want to, we have our supplies ready, and you want to go ahead and measure how far we're going to insert the tube. So you're going to start at the tip of the nose, come back to the ear lobe, and then down to the xiphoid process, which puts us at 56. You can mark that off with a piece of tape. Then we're going to, you can have a cup of water or, you're going to go ahead and lubricate the tube about 3 or 4 inches, and then you can have a towel ready, and then just explain the procedure to the patient. Have them put their chin to their chest and swallow as the tube is inserted. Swallow, 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 and okay. We're going to pretend that we have the tube in at the 56 mark. We're going to go ahead and tape or secure the tubing to the nose. Okay. So make sure your patient is okay. Now we're going to verify placement. You can take a syringe and have the litmus paper to verify the pH. Go ahead and aspirate some gastric contents. Test them on the paper to be sure that you have in the right spot, and you also will need to do an x-ray to verify placement. So once we have all of that done, we can connect to suction, we can connect to feeding. Today we're going to connect to suction. Be sure that everything is clean. You always want to verify placement before you go connect any other device. So we have our suction connected. We can turn it on, and then okay, now we're going to discontinue the suction and DC the NG tube. So again, you want to make sure you've performed hand hygiene, don sterile gloves, verify your patient, verify the doctor's orders. Okay, we're going to disconnect our suction. Okay, have a towel ready because the procedure can be messy. Now you want to we're going to remove the tape, and then we're going to explain the procedure to the patient, and we're going to ask them to hold their breath. We're going to remove the NG tube quickly as they, just a little bit at a time, okay? And then properly dispose, provide care to the nostrils, clean everything up, be sure they're not irritated. If you want to remove your gloves, perform hand hygiene, and document the procedure. Okay, we're going to talk about enteral tube feedings. In the previous video, I inserted a nasogastric tube
and also deseed it, but you can administer medications through that tube. You can suction through the tube. You can provide feedings. We do not have a feeding bag or a pump here now, or I do not, but I'm just going to walk through the steps. I do have the syringe that we would use for the feedings or for medication administration, and this is going to serve as the formula. So first we want to verify the physician's orders, identify our patient, and check for any allergies. You want to perform hand hygiene and don clean gloves. You want to prepare the enteral nutrition. If some cases it may be pre-mixed, but there are times when you actually have to pour it into the bag. So in that case, you would shake the formula very well and then pour it from the can into your bag. You want to be sure to close it good and then hang it, attach your tubing, and you want to prime the tubing. So usually the kangaroo pump would have an option to prime the tubing for you. You can set the pump to the rate you want to deliver and the volume to be infused over, how long, if it's continuous, and then sometimes they'll have like a flush bag connected as well, so you can set the feeding if it's continuous at one rate and then the flush at another rate. But you always want to be sure that the patient is positioned in high Fowlers, and always verify tube placement, and you can do that. And at the same time, you can check the residual in a sense. So you would connect, you would have like a Lopez valve at times. So you can connect the syringe, pull back. Sometimes you may not get any secretions or just a few little bubbles, but if you get some contents, you can test that on litmus paper, check the pH balance, or you can also, check the residual. That should tell you that you're in the stomach. So if you have more than 500 mils, ideally, or 2 checks of more than 250 mils, 1 hour apart, you want to stop the feedings because their body isn't, for whatever reason, is not digesting it quickly enough. So you don't want to put them at risk for aspiration or just overfeeding. So if it's less than 250, you can usually, depending on your hospital policy, you can return the residual back into the tube or back into the stomach. You always want to, if you're going to give the feeding, say by like a bolus feeding, you want to remove this part. You can connect the syringe to the tubing or to the Lopez valve. You want to flush first with 30 milliliters of water. And then you would pour the bolus feeding in as ordered, and then follow up with a flush. Okay, if you have a continuous feeding, you would, like I said, you could just, disregard this part after you check the residual, then in the placement you would be done with the syringe, so you would just have your tubing connected to the Lopez valve. Be sure to turn the valve in the correct position so that the milk doesn't just pour out all in the bed, all over the patient, make a huge mess, and then you don't know until you go back in or someone else finds it. Let's see. For a continuous feeding, you want to flush with 30 milliliters of water every 4 hours. And like I said, sometimes the pump will be set to deliver a flush. You always want to check for the residuals every 4 to 6 hours, or whatever your agency policy is. there are rules and policies in place on how often you should change the bags. So normally you would change the feeding bag and the administration set every 24 hours. So that's why we always want to be sure to label the bag with, the date and time and your name when you changed it, so that the next person can come in and see how long it's been and change the bag. Okay, so you also want to provide care to the site. So you want to be sure that there's no, signs of infection. Remove, sometimes they'll have like an AV pad around the site, but remove that. Look under there and make sure there's no signs of infection, something oozing from the site. So, and clean that area very well daily. You want to always document the feedings, the residuals, the appearance of the site, and if they're nauseated, and then keep up with the intake and output on the patient. So, and then, like I said, you may administer medications here. You do not want to push, you want to keep the syringe in the upright position and allow the liquid and the medication to flow by gravity. Sometimes you'll have to work with it and unclog it with the syringe. And then, like I said, always be sure that once you're done with that, that you turn the Lopez valve back into the correct position.